2005, that is the highest level. It is expected to maintain a high level in the future. See the Japan's rate. It's around the Western countries. Among Asian countries, you can see here, Japan, amongst Asian countries, Japan has the highest aging rate, and South Korea and Singapore expect us in aging similar to those in Japan. The following figures show the rate of the aging in Japan. From this, we can see this characteristic of the aging population in Japan. The figure compare the number of the year required for the aging rate to reach 14%, double the rate after it exceeds 7%. As can be seen in this figure, one of the characteristics of Japan is that it takes only 24 years compared to 115 years in France, and 85 years in Sweden, 72 years in USA, 46 years in UK, and 40 years Germany. For this reason, since the 80s, the Japanese government has been striving to build a social security system for an aging society. Long-term care insurance in Japan came into effect in 2000. 23 years have passed since then, and the number of the elderly aged 65 and over will reach more than 30 million by 2025, and peak at more than 38 million by 2042. It is remarkable that the percentage of the population is 75 and over will continue to increase. As shown in the figure on this side, one of the characteristics of the elderly population in Japan is an increasing number of the elderly person aged 65 and over with dementia, who have a moderate level in independent in daily living. As shown is a figure on the other side, age 65 or over, and a household composed of the elderly couple on the rise. Another characteristic of the elderly in Japan is that the number of the elderly people living alone is also expected to increasing. In addition, the elderly are characterized by the rapid increase the population over the 75 years old in urban area, and also the increase in rural areas is similar. A different aging situation is each area, and a need to respond to the characteristic of each area. So these characteristics have been identified in Japan. So this is you can see from the figure on this side, the trend of the people over 75 with the increasing number of the people require the care. So the Japanese population is 75 and older is growing rapidly over the 10 years, rapid from the 2015 to 2025. In addition, the population aged 85 and over is expected to continue growing from around 2030. As shown in the figure of this side, this is the population of the long-term care insurance premium payers will decline after the 2025. This means that is very important. This means that Japan will face the situation where there will no longer can be the balance between those who receive the long-term care services for the elderly and those who pay premiums. In Japan, we have recently been told that we are living in the age of 100 years. This is context. An important focus is not simply to increase average life expectancy, but to extend to period during which people can live in good health. In other words, healthy life expectancy. In Japan, we have recent the figures show the difference between average life expectancy and healthy expectancy, which as of 2015 was 9 years for men and 12 years for women, female. In other words, these differences is the length of the time that long-term care and other service will be needed. And because of the increasing the social security, and we need a lot of cost. So it's the balance is like unstable now. And in this context, I will review the recent global health care spending situation for terms of healthcare expenditure years (GDP) for major countries. The average for the 35 OECD countries is the average 9.2%, while the United States has been the highest is 60.6%, and Japan at 11.5, Korea as a 9.7, and China is a 5.7%. And Japan is said to have a high level of satisfaction from the world as a whole, as well as being able to provide equal medical care and advanced medical care to all its citizens. When I have described so far characteristic for the elderly population in Japan. So next, I would like to explain the current situation of the family caregiver in Japan. Recent year, especially in Japan, the issue of the family member quitting their job to take care of the family member has become an issue. First of all, I would like to tell you that many family caregivers in Japan are under tremendous stress. Various survey has shown that the burden of the family caregiving is now seen as a social problem. There is a growing demand to move away from traditional family-centered care in Japan and to provide more social caregiving. Japan forecasts challenges for the future in terms of the nursing care workforce and the resulting serious human rights violations posed by the increasing number of the families unable to secure social caregivers, that growing number of elder people with a dementia, and the increasing incidence of the elderly abuse. The following as the overview the situation of the caregivers in Japan. Caregivers are spouse and children, and the children's spouse and the others. Women, female are not the only caregivers. You can see the male elderly caregivers also exist. The current situation of the elderly caring for the elderly is a characteristic I mean, elderly care elderly, and is expected to continue in the future. According to the result of the 2017 National Survey of the Workers who are family caregivers, of the 6.3 million family caregivers, more than half, 3.5 million, continue to care for their family while working. The number of both men and women, male and female, who are family caregivers while working is increasing. And the program of the balanced work and family caregiving is expected to increase in the future also. Among the 6.3 million family caregivers, 70% are under the age of 60. Both female and male caregivers are also found to be in their 40s to 60s. This is a time when they are also playing an important role in their companies and are being responsibility for the family caregiving at the same time, maybe causing them considerable stress. I mean, under the stress, their make a balance, the company and working there, have a big responsibility also. If they go back to home, they are have a responsibility of the caregiving. And among the 3.5 million people, 90%, I mean, 90% are not receiving caregiving support from the government. In particular, working in their 40s or older, who are in managerial position with increasing responsibility and unable to take advantage of the government provided caregiver leave program. We have a program, it's caregiver leave program, but they cannot use. About the 100,000 people quit their job to care for the family member in 2017. The rate which women quit their job is particularly high. It is estimated that this is not decrease in the future. As part of the Japanese government effort to improve the environment for balancing work and nursing care, the government is promoting the successful use of the service support related to the nursing care while making use of the system related to support for the balancing work and nursing care in the workplace. Recently, however, the system cannot be used for part-time worker and even while the system is available. In many cases, actual utilizing of the system has not yet been achieved because the company, like the atmosphere, is difficult to take the time off. There is no one to take over one's work, or the employee does not want to use the system because it affect his position, the higher position. So finally, I would like to discuss policy trend in support of family caregivers in Japan. We conducted a study in 2018 on the quality of life of family caregivers in Japan. The survey subject were those who work and care for the elderly person who is a family member who use the long-term care insurance services. There were 600 subjects, the people, and among them, the 376 men and 224 women. The average age was 51.6 years old. This survey result indicate that family caregivers who are employed are often characteristic by their family members, especially son and daughter who are involved in the caregiving process. And also we recognize the factor related to the carers QOL is a good health and satisfaction with the caregiver's workplace relationship. And activity daily living ADL and IADL of the person needed care are like a minor level of the care, not heavy care. One of the conclusions from the survey result is that the improving of the quality of life of family caregivers is related to balancing caregiving and work. That social policy are needed to achieve this. A community-based integrated care system, that is a support caregivers. I'm sorry, I would like to talk about the policy trend the support of the long-term care in Japan. We had three policy contents for supporting working supporting working carers in Japan. The one is the community-based integrated care. And second is no one forced to leave work for the family caregiving. And third one is New Orange Plan. And community-based integrated care system is the system that supports the caregivers, like a medical care, nurse care. I will show the next slide. This is the we provide the medical care and nursing care and prevention, housing, daily life support are provided in the integrated system so that people can continue to live their own lives in their families, neighbors, and until the end of their lives. This is to create a system in which mutual support by local residents and public support are linked. So therefore, in order to support family caregivers in Japan, it is important to strengthen the capability of the local welfare and the social work functions related to the medical care and nursing care that the support system. Especially, it would be necessary to strengthen social work function and the development of the community-based coexistence society, and the establishment of the comprehensive consultation and support system, and finally, the building the system that empowers residents to proactively identify and tackle community challenges. So it's we can achieve the integrated care that provides support for balancing the work and the family caregivers. This is the final one. Community social work function are particularly important to strengthen the consolidation of the community-based integrated social care system in Japan. So I believe that achieve hold the key to balance work with family caregiving. So maybe we have to continue to developing the community social workers in Japan. Thank you so much for your attention, and I would like to discuss what is an example from approaches in Japan that could be helpful in Sri Lanka, and how would you assess the situation of the family caregivers in Sri Lanka, and how do you propose to address family caregiving in Sri Lanka, so we can discuss after this my presentation. Thank you so much.